Hello everyone, I'm Dr. Anil Kamath. I'm a senior consultant surgical oncologist here at Healius Cancer Clinic. So let me take this opportunity to talk to you all about parotid tumors. What is the parotid gland? Now, parotid gland is one of the saliva producing glands. It is located in front of the ear, somewhere in this region. So tumors in the parotid gland are quite rare, but every now and then we do see these tumors. Most of the time, the swelling presents as a swelling in front of the ear. So, most of the tumors, almost 85% of these tumors are benign tumors. That is, they do not have the tendency to spread. The most common benign tumor is a tumor known as the pleomorphic adenoma. Now, how is this diagnosed? How is it treated? Let me just walk you on through all this. So, any swelling in this region, in this parotid region, needs to be evaluated properly. You have to meet a doctor who is experienced in dealing with these tumors, and a physical examination is done. Then, the most commonly performed tests are either a CT scan or an MRI, and for diagnosis, we do a fine needle aspiration cytology, or we take a small amount of material for the pathologist to see under the microscope and confirm that these tumors are benign. So, once this is done and we come to a conclusion that this is a benign parotid gland, then only we jump into treatment. In terms of treatment, the main and probably the only treatment is surgery. So, the surgery done is called a superficial parotidectomy. Now, the parotid gland has two parts. One is the superficial part and other is the deep part. These two parts are separated by the facial nerve, the nerve which supplies all the muscles of the face. Now, the challenge in any parotid surgery is to prevent any damage to the facial nerve. So when we remove the lobe which is superficial to the facial nerve, it is called a superficial parotidectomy. So normally we go through an incision which is hidden, which is not, which one sees, it's very difficult to make out that the surgery has been done. While doing the parotid surgery, it is very important to identify the facial nerve and preserve all its branches. That is the main challenge for the surgery. So once it is removed, if there is any damage to the facial nerve, it leads to weakness of the facial muscles and sometimes deviation of the angle of the mouth. And some others may have difficulty in closing the eyelid. So once we do the surgery, we send the tissue which is removed to the pathologist and get a final confirmation that these tumors are harmless. So this is what I wanted to be able to be aware about the parotid gland and the tumors in the parotid region. Thank you.